drinking, right? That could lead you down that path as well. And you never know what your DNA may uncover. You take one drink and you're hooked. So be very aware of your family history as well when ingesting these substances. Okay, thank you. Next slide. So I just kind of was, when I heard this term about 3 years ago, I thought, well, why would you want to do that? Why would you want to get crossfaded? Why wouldn't you just want to do one or the other? Okay. Well, somebody somewhere asked these questions, and there were three main answers given every time this question was asked. Okay. The first one was to enhance the effects of the first drug taken. So if you've been smoking, you drink, and it intensifies the high from the weed, okay, or vice versa. It'll intensify the feeling of the alcohol in the body when you're smoking. If you drank first, okay, to increase the level of intoxication. So if you're feeling it more, then you're gonna be feeling it more, if that makes any sense. So whichever one you choose to do first, if you add the other one to it, it intensifies the effects of that particular drug. Okay. And because they're no longer making rational decisions about substances they're taking, they're just doing it, right? Some people just go along with the crowd, not really thinking about what I'm doing. I'm just doing it. Okay. So those were the three main, I guess, reasons that people chose to drink and smoke weed at the same time. And I just thought, okay, boredom's not on there at all, or peer pressure, or any of those things wasn't on there. But these three were the main three. Okay. All right. Next slide. Okay. So here are some of the effects of being crossfaded. After individuals drank a large dose of alcohol, the THC levels in their blood plasma nearly doubled. So there's what we just talked about alcohol intensifying the effects of THC or marijuana. Okay. Um, the effects of THC on the brain are amplified, so it makes the high more intense. You're seeing brighter colors and bigger rainbows and all kinds of whatever you're seeing more intense. Okay. And then there's the greening out effect, and we'll talk a little bit more about that in just a little bit. Okay. The inability to vomit. We'll talk a little bit about that and why that's important as well. Alcohol poisoning. Okay. Increased probability of accidents, drowning, car wrecks, etc. Now, people who smoke and drive usually don't think that they're a problem on the road. But if you think back to those side effects of weed, it was the ability to make, you know, good choices. It impaired the brain. So if your brain is working at an impaired level, you definitely don't want to be driving a 3,000-pound vehicle, right? If you're not really there. And a lot of the times, people think just because they're a little buzzed that it's okay to drive. Not true. Not true at all. And definitely don't do it if you're crossfaded. Okay. No hot boxing or anything like that. Okay. Um, an increased risk of dependency. And there it is again. If you're smoking and drinking, you have to take into consideration what you're doing to your brain, right? The more you use, the more your brain wants it. Okay. Not to mention your genetic makeup. If you have that genetic predisposition to um, addiction of any kind, this could be a problem for you, right? And the decreased cognitive function of the brain functionality. That's just meaning that your brain is not functioning at a level that it would if you were not on the substances. Okay, it's at a decreased level of functionability because again, these are mind altering substances. whether they're legal or not, they are mind altering. Okay. Just because it's legal doesn't change what it does to the body. Keep that in mind. Okay. Next slide. So I thought this was interesting when I was doing this research. And by the way, there is not a lot of research on getting crossfaded, but it has been around forever and ever. Amen. I was watching, I don't even remember the movie. It was like a clip of the movie, and um it had to be like in the 70s because the guy had like a bandana on and he was like a biker dude, right? And he was there with his joint, and he had a can of beer. So that was all the way back in the 70s. I'm sure hadn't given it a name, but feeling good, partying, whatever. But now they call it something different, which is crossfaded. So which do you do first? Well, I thought this was very interesting because I didn't know why it mattered. Okay, so let's talk about it. Drinking before using weed can intensify weed side effects. Okay, this is because alcohol increases the absorption of weed's main psychoactive drug, which is that THC. This generally results in a stronger high. Okay. While this might be nice for some folks, it can cause others to green out. And here's where we're going to talk about that term, greening out. Greening out refers to the unpleasant effects like nausea, unease, hallucinations, and other distressing symptoms that sometimes occur after consuming too much weed. Okay. That's what's called a bad high, right? That's when you hear people say, oh man, I had a bad high. I'm not going to be smoking for a while. That's usually what they're referring to. Okay. Um, what that means. Okay. Using weed before drinking alcohol may minimize the effects of alcohol. Okay. I thought the opposite. And when it says minimize the effects, you would think, oh, so you don't get as drunk? No, you do get as drunk because why? You drink more. Okay. And here's the reason why. This means that you might be tipsier than you feel. Okay. Increasing your risk for becoming overly intoxicated. So it doesn't lower the amount of alcohol in your body, it lowers the amount that you feel. Okay. So you don't feel as drunk when you mix alcohol and weed. You don't feel as drunk. It doesn't mean that consumption of alcohol is not still in your body, because it is. Okay. If you use weed before drinking, pay extra attention to how much you've had to drink. Okay. That is what the literature told me. If if you're considering experimenting, make sure you're taking note of how much you're drinking. And err on the side of caution. Assume that you've had way more to drink than you normally would have. Okay. Assume that you've had more to drink than you normally would have, and really scale that back a little bit. Okay. So remember, um, using weed before alcohol lowers the feeling of being intoxicated or being drunk. Okay, it doesn't lower the amount, obviously, of liquor that you're putting into your body, but it lowers the effect, or it, I guess, delays the effect of feeling drunk. So that's why it can be so very dangerous and can lead to alcohol poisoning. Okay. All right. Next slide, please, ma'am.
I think I'm
Okay.
gonna have to stop sharing and then share in a different way.
Okie dokie.
Oh,
And so, guys, rather than me give you all these sort of technical terms and all this kind of stuff, I just want you to see what I've been explaining to you, so you can kind of get a better idea of what it is that I was saying. And this little cartoon or this little video, I thought was pretty self-explanatory. So let's take a look.
It opened in a different screen. Hold on.
Uh-oh. It's being difficult.
And I think there's
You can count on us to show up. Marijuana is one of the most popular drugs for those who drink alcohol, but are there specific benefits or risks when taking them together? What happens to your body and brain when you're drunk and stoned at the same time? Alcohol affects your central nervous system by changing how your neurons communicate. It suppresses the excitatory neurotransmitter glutamate and increases the inhibitory neurotransmitter GABA, which causes information flow to become slow, making you feel less, perceive less, and remember less. Weed, on the other hand, contains THC, which acts on the brain's cannabinoid receptors and causes some neurons in the brain to continually fire, removing their normal refractory period, making your imagination and thoughts magnify. But because both alcohol and weed inhibit glutamate transmission, a key part of your learning process, their combined use is linked to poor memory. A study using rats found that their ability to recognize objects was severely impaired when they were drunk and high. Of course, consuming both will make you feel lit, and studies show that even after taking 2 shots, the THC levels in participants' blood plasma doubled compared to those who were stoned but consumed a placebo drink, meaning alcohol makes you more high. Participants also felt the effects of weed more quickly and reported a better high with a better mood and other euphoric effects. Researchers believe that this is due to vasodilation. Alcohol causes smooth muscle cells in your arteries to relax, widening of the blood vessels, and an increased blood flow, all of which allows more THC to cross your alveolar sac, a part of the lung where gas exchange occurs with the blood. Ultimately, the alcohol is increasing THC absorption. Other research has found that smoking dope may even reduce the damage alcohol does on your liver. When you drink, ethanol is metabolized by the enzyme cytochrome P450-2E1, but after excessive drinking, this process causes oxidative stress, making cells in the liver become fatty, known as steatosis. Cannabidiol, a chemical component of marijuana, was found to inhibit the cycle that causes this oxidative stress on your liver, protecting it from damage. But before this becomes your go-to party duo, consider that marijuana prevents vomiting. It's one of the reasons medical marijuana is prescribed to chemotherapy patients to help ease their nausea. But in the case of alcohol poisoning, vomiting is the body's way to remove excess alcohol. So being unable to vomit poses serious health risks. Curious how other drugs affect your body and brain? Check out our drug video playlist, which explains even more, from the effects of shrooms to cocaine and even coffee. And subscribe for more weekly science videos.
All right. Thank you, ma'am.
No, I'm a little slow, so I gotta close this and then reshare.
That's okay. That's all right. So the big takeaway from that video was basically that alcohol on weed makes you feel more high, okay? And weed on alcohol makes you feel less drunk, okay? That's the gist of it. So again, be very careful when you're mixing these two substances because they can lead to some really bad side effects and even, again, alcohol poisoning. All right. So does anyone to this point have any questions? Y'all see me? Can't see me? What happened to my... I don't know where my video went, but...
May have accidentally turned it off.
There it is. Here I am. Can y'all see me again? Okay. All right. If there are no questions, then let's move on. You see anything in the chat? I don't. Nothing. Okay, good. Let's continue then. All right. If you would, to the next slide, please, ma'am. All right, so let's talk a little bit more about that greening out. Okay, remember that's the bad high. So if you've mixed weed and alcohol and you're having a bad reaction, it's because alcohol seems to make the high from weed use stronger, right? We've just talked about that. And it results in all of these unpleasant feelings known as greening out. Okay. And this can happen anytime you've consumed too much weed. It doesn't necessarily have to be with weed and alcohol mixed together, but anytime you've consumed too much marijuana. Okay. I just wanted to give you some signs of a green out, because if you're smoking or someone else around you is smoking, you should be able to recognize these symptoms. They'd have shivers or chills. Okay. They would be sweating. Their heart rate would be increased. Lightheadedness. Lightheadedness, I think, would be a part of getting high, but it's an intensified lightheadedness to where they're stumbling. You don't normally stumble when you're smoking weed. The nausea and the vomiting can be a significant giveaway, because again, marijuana is supposed to counteract that. So if your body is wanting to expel it or vomit it out, then you may be in a bad situation. And an increased anxiety or paranoia. Um, Weed smokers usually tend to be a little more skittish, but this is more of an anxious kind of, I can't sit still. I'm having these intense feelings of anxiety and paranoia. That could be a sign that you are greening out, or someone around you is greening out. Okay. Next slide, please. So, in the event that you are, having one of these bad highs, or with someone who is doing it, what can you do to until the feelings subside? And they will. You just have to ride it out. The first thing to do is to stay calm. Right? Again, your feelings will subside. It just takes time, and you can't really give it a set amount of time, because each individual person is different. Okay, sit or lie down, making sure that you're not trying to drive or walk or any of these things, because again, your brain is not really in the best state. So you want to get somewhere and you want to stay. um, Eat or drink to boost your blood sugar level, right? This will help to make the high come down, so to speak. It'll raise your blood sugar so that you'll start feeling more like yourself. Okay. Drink water. Drink water, because smoking weed and drinking alcohol can give you what they call cotton mouth, or your mouth is really, really dry. So you'll want to continue to drink water. Next slide, please, ma'am. And if you're drinking water, or go ahead and squeeze. You can squeeze a lemon in there. The chemicals in the lemon can counteract or decrease the effects of the THC on the brain. So add some lemon zest or some lemon juice to that water. That'll help that high to come down as well. Now, this next one I don't recommend, especially if you're crossfaded, because you might slip up and sniff some pepper up your nose. But the literature told me that this is an option. You can crush up some peppercorns, and not getting that close, but taking some, swift inhales of the peppercorn, being careful not to sniff it up your nose, because that would not be good. But that can counteract the THC as well, kind of like the lemon juice, the lemon chemicals. Okay. Talking to someone, this will help you refocus yourself until your high can come down a little bit. Talking, listening to music, try to get someone that you trust on your side, to stay there with you. If you're a bit paranoid, ask them to stay with you, or just in the other room, so that you can feel a little more at ease and your anxiety levels can come down a bit and you can calm down. Focus on something else until your brain can come back to where it likes to be. Okay. Next slide, please. So, when to get help. So, if you've been drinking a lot, okay, and you're crossfaded, it can be very difficult to tell between a green out and alcohol poisoning, okay, which can be life threatening. Alcohol poisoning can be life threatening, guys. So we don't ever want to get to that state of mind. And in that situation, you do need to seek emergency medical care. If you yourself or someone that you're with is having these sort of symptoms: vomiting, confusion, seizures. If someone is convulsing, they are not in a good state of mind and they need emergency medical help in that moment. Okay. Their breathing is irregular or very shallow. That is a very big sign of alcohol poisoning, as well as the bluish um, lips or skin. That means oxygen is not getting to where it needs to be. So that is a very big indicator that something may be going wrong. Their body temperature is very low. They feel cold and clammy. That's not a good sign as well. Okay. And definitely, if they are unconscious and you're not able to rouse them, get them some help. Okay. You'd rather err on the side of caution than on the side of being sorry. So get them some help. If you can't rouse them, if they're not waking up, get them some help. Remember, consuming weed after drinking alcohol might make you feel less intoxicated, but that does not mean that the alcohol is not still in your system. And if too much alcohol gets into your system, whether you feel it or not, it can cause alcohol poisoning. I cannot stress that enough. Okay. Usually a bad reaction to weed and mixing alcohol will pass a few hours, or maybe you might even wake up the next day still a little funky with it, but you should be able to get back to quote unquote normal, within the day. So if you're not, then you need to get to some help. Okay. Next slide, please. And on this next slide, we're just going to be looking at some, yeah. Okay. Both weed and alcohol together and on their own are potentially addictive. Okay. Don't forget that. Weed, alcohol, all by themselves can be addictive. Now imagine your brain on both of them at the same time. Okay. It can lead to becoming dependent on these substances. So be very careful. Okay. Contact your healthcare provider or call the Substance Abuse and Mental Health Services Administration hotline. And there's that number. If you feel like you're drinking or smoking to escape some things, you may want to get yourself some help. Okay. If you find yourself dealing with cravings, okay, a lack of control over how much you're drinking or how much you're smoking, anxiety that's like relentless, right? It's just more intensified. Restlessness or negative thoughts, even when you're sober, okay? Irritability and moodiness, disinterest in other things that you used to really love to do. You really don't care about them anymore because all you want to do is what? Smoke or drink, okay? Changes in your appetite and sleep patterns is a big one, right? If you're sleeping all the time, or if you're not sleeping at all, and that's a big 180 from what you're normally doing, you may want to consider talking to someone about your consumption of these substances. Another thing is difficulty fulfilling obligations. So if you've made plans with your girlfriends or with your guy friends and you keep backing out, all you want to do is sit at home and smoke and drink, that's a problem. Okay. So take into consideration all of these things. If you feel like this may be your issue, then please don't hesitate to get you some help. Okay. I know that you guys have people on campus that you can talk to as well. Seek those people out and definitely let them know what's going on with you. Okay. Next slide, please. Whoops. Have we? Can you hear me?
Yes, I can hear you.
Okay. All right. I was just making sure. All right. So there are definitely healthier alternatives to smoking and drinking, guys, right? And many of those healthier alternatives, they become with keeping your stress levels at a minimum. Okay. What are some of the things that you guys do to de-stress yourselves? You can either put it in the chat or raise your hand and let me know what is it that you do to sort of de-stress yourself. Ooh, CrossFit, yeah. I like that one. Nice. Manis and petties, massages, workout. I love it. Nice. Running. Oh, I'm not with that one. I can do all the rest. My knees say no to running, but good. That's good. Good. So you guys are obviously in college and it's stressful, right? It is stressful. I'm not sure of your where you are in your course studies, but if you're brand new to college, it can be overwhelming when you have all of these things and no one's really telling you to do it. You have to be that self-starter. You have to be the one responsible for it. It can be very, very stressful. So, as opposed to, going out every weekend and getting lit, you can start managing your stressors so that you don't feel like you have to, ingest so much weed or alcohol every chance you get, right? To get away from your stressors. You can manage your stressors as you go along. And here are just some ways that you can do that. Take control of your surroundings. What does that mean? Well, if there are things that you can see that you can, I guess, fix, do that. Whether it's your living space, if you're cluttered up and you can't really think and that gives you anxiety, which then leads you to want to drink or smoke, clean up and keep your living space organized. Okay. Whether it's avoiding people who bother you, right? That seems very, very trite, but people can be annoying. And if you have to be around them, you have to learn how to cope with them. So avoid them as much as you can. It can even be a family member that, is getting up under your skin. Take a time out from them. Just time out. I need a break from you. And, sequester yourself away from them and allow yourself to get back to feeling okay, right? Here's a big one: learning how to say no or to state your limits in advance. Okay. It is so hard for some people to say, no, I don't want to do that. Okay. Because you may not want to offend anyone, or you may not want to hurt anyone's feelings or anything like that. But guess who's the most important right now? It's you. You're the most important person. So you have to learn how to state your limits in advance. All right, friend, I may or may not be there. I'm going to try, but I'm not going to make any promises. That's you stating your um, intentions or your limits in advance, okay? Or just plain say, no, I can't do it. I can't do it. I got too much on my plate. I can't do it. Okay, that's acceptable. Ditching part of your list. Now, this is a big one for me because I am a list liver. I live on my list. I make lists every day. I got a list right here sitting next to me. And it gives me so much anxiety if I can't complete my list. Okay. What I've learned to do is to accept that, okay, this is my list, but I may not finish it. And that's me stating my limits in advance. I may not finish that list, but I'm going to definitely try my best. And if I don't, it's okay. All right. So ditch your list. Here's another big one: communicating your feelings openly. Okay. You have to tell people how you feel immediately if you can. It's important to not push those feelings down or push your feelings aside, because what will happen eventually is they'll get pushed down so much until they tick, 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 boom, and you explode on someone. Or you take it out on yourself by drinking, smoking, doing things that you wouldn't normally do because you're not feeling your best inside. Okay. So it's important to get your feelings out and communicate them openly. Sorry about that. Um, Time management. Now, I can't preach on this one because, I'm not the best at managing my time, but my list helped me a lot. I set timers a lot during the day, especially if I know that I have to get something done. I will set a timer. And that's so crazy. I'll have little ding dings and pop pops going on all throughout my day just because I'm trying to stay on schedule. It helps me because I can get caught up in something on television or looking at my dog sleep. That's just who I am as a person. So I have to do something in order to help me manage my time. Okay. So whatever that looks like for you, do that. And I can guarantee you that will bring your stress level way down. Okay. Talking with someone. And I don't mean pouring out your soul and giving it all to them, laying it all on the altar. That's not exactly what I mean. When I say talk to someone, it just means that I have someone that I can confide in. If I'm working furiously and fast all day long, I'm going to give myself permission to call my friend at 0:12:30 and say, "Hey girl, how are you doing? What you doing?" And I'm going to take a break. That is going to bring my stress level down. She'll make me laugh a little bit, and then I can get right back at it after we get off the phone. Okay. Just having an out can sometimes mean make a world of difference in managing your stress. Okay. Forgiving. Whew, this is a big one. Okay. I tell people all the time, forgiveness is not for them, it's for you. Okay. People can carry their stress on their shoulder and it'll manifest in their body. They'll have headaches, they'll have backaches, they'll have toothaches and tummy aches, all of these things just because you're carrying something, some ill will or ill feeling towards someone. Forgive them. And that is for purely for you. You don't have to agree with what they did, but you have to forgive them because forgiveness will help you to de-stress your body. Okay. So forgive. Positive self-talk. Now, this is a big one as well. You never realize how mean you are to yourself, right? You are, we're so mean to ourselves. Think about it. Girl, you're so stupid. Why would you? That was so dumb of you. You can do so much better. What are you wearing? I mean, these are the things that you say to yourself. Now, you wouldn't walk out into the public and say, "Girl, what are you wearing?" to someone that you never met, but you do it to yourself, right?
I
And
do that.
if you, yeah, if you're not thinking about it, it can become a habit just like that. It can become a habit. So let's reverse that habit and throw some happiness and some uh self love in there. Tell yourself good things. Oh, I look good today, or I like my hair. Small little simple things that you may not even, you may be embarrassed to tell somebody that you're celebrating. Who cares? Celebrate it anyway. It's okay. And then you'll train yourself to put that positive self-talk into your way of talking to yourself. It's important and it will help manage your stress. Okay. Walking away from situations. Walk away. Just you don't have to say one word. If you see that that situation is not serving you, walk away. You don't have to say one little word, just walk away. Okay. And one that I didn't put on here that's very important is breathing, right? When you don't have anything else, you have your breath. It's a deep cleansing breath can save you so much stress. And in that breath, when you're taking that big inhale, you can be praying to whatever you pray to give you the peace that you need, right? Just taking in that breath and cleansing your brain and allowing your brain to come back down to homeostasis in the middle where it likes to be so that there's rational thought. You're not too excited. You're not too stressed out. Your brain can then begin to process better. once you have brought it back down to where it needs to be and managed your stress. Okay. Next slide, please, ma'am. Okay. So in conclusion, the bottom line is this, guys. Okay. It might seem harmless to mix alcohol and weed, but doing so can be a slippery slope toward getting overly intoxicated. Okay. If you want to mix the two, pay careful attention to how much of each you're consuming, especially if you've never gotten crossfaded before. Okay, I don't recommend, but if you're going to do it, please, please, please be very, very careful. Okay, and that is all I have for you today. Do you guys have any questions? Any questions? All right. Well, I am hoping that you guys got some good information out of this, and I'm hoping that you will take all of this information into consideration the next time you're out and about with your friends, doing what you do. You know, you are the author of your fate right now. So you choose, okay? No one's here to tell you yay or nay or don't do this or that. You're grown-ups and you can do whatever it is that you want to do. As long as you have the information and the knowledge, then you can make an informed choice. And that's all that we're about. So I'm hoping that you learned something from this presentation. And I am so very grateful that you guys took the time out and allowed me to present to you. I hope that we can do this, Melanie. This was such a great idea. I'm so glad that you and Katie collaborated and allowed us to come into your forum and talk. So I appreciate you. We appreciate you. And you guys were awesome. Thank you, thank you, thank you for your attention.
Yes, and thank y'all for doing this. It was very informational, all of the different sessions. And so some of the students or faculty, I think, attended pretty much all of them from names that I've seen regularly. So I'm glad we've been having that, and then the people that are able to watch it later on. So unfortunately, I did forget to start recording at the very beginning. I think I remembered about 20 minutes into the presentation. But at least some of it is recorded.
Okay.
And so that will be uploaded to YouTube later on. But yes, anybody have any last minute questions or anything? And so if you want more information, I can give that to you, or you can get with me and I can get you connected with Midcoast Family Services and all the amazing resources that they have. Any last minute questions or anything for anybody?
Oh, I just wanted to say, I know I came in a little late, but I was hearing your presentation and it was awesome. I learned a lot from it. So I just want to say thank you. I really appreciate you sharing that. And I really learned a lot from it. So thank you.
Oh, thank you. Thank you for being here. I appreciate that. And again, guys, you are not living in a vacuum. If you have questions about anything, reach out to your counselor. That's why she's there. She is on your side. So make sure that you utilize her. She is on your team and she wants the best for you. So again, thank you guys for attending. You guys were an awesome audience and I certainly enjoyed doing this presentation. So thanks again.
Thank you. Everybody have a good day.
Thank you.
Oh yeah, and Melanie has my PowerPoint. If you want it, she can get it to you. Okay. So if you want this PowerPoint, you can definitely have it. She has it there in her possession. All right. Thank you guys. I appreciate you. You guys have a wonderful evening.
Thank
you for your knowledge. Thank you.
Absolutely. Thank you. Thank you.
Thank
You're
you.
welcome. Y'all were awesome. Thanks, Melanie. You were